Hello, I'm Dr. John Heise. I'm the Director of Adolescent Medicine at the Children's Hospital Erlanger. And unfortunately, this has been a rather difficult year. So we have had a lot of mental health concerns, and there's just been some questions from the lay public and the professional areas, as well as locally, what is really going on with our youth about mental health. So this is a discussion to kind of go over this. And we're going to be looking at kind of the international datas as well as the kind of national datas, and then hopefully locally that will give you some ideas. Of course, I'm not going to be discussing any investigation use. I'm not going to be discussing inappropriate use of commercial products, and I'm certainly not financially benefiting from COVID or mental health illnesses. So we're going to go ahead and kind of discuss kind of from the aspect of youth, and this youth would be basically middle school to high school to college age. Most of the studies have been with the adolescents, so in high school and college, but it does pertain to middle school, and you'll see some of this even down to elementary schools. But first of all, COVID has been affecting everybody. I don't think there's anybody in the world that really is not aware of COVID-19 and has not been affected by this. Too many of us have lost family members or relatives or even spouses or children to COVID. But even those who have not been affected by the physical manifestations of COVID-19 illness, it's been affecting their lives. I just wanted to kind of read this. This was something that a 19-year-old girl told me in clinic about a year ago. This was right when she had already been doing the virtual learning for several months, and she just learned that her prom was canceled. And so she told me, it's just not fair. I've been looking forward to my senior year all my life, and it has been ruined. I had to suddenly finish my year studying from home. I can't finish my senior year in sports. I can't go to my prom, which I've been dreaming about for years. My mom still has to work and then is so tired working her second job. Dad lost his job and doesn't help much around the house, and I have to watch my brother. I found out that the college I was going to next year will not be open for campuses and will only have virtual classes. I hate virtual studying. Worst of all is not being able to be with my friends and boyfriend. It just isn't fair, is it? And no, it really isn't fair. Unfortunately, it's affected all of us. So let's kind of go ahead and see how it's affected. So we have seen in the lay press, we've actually kind of seen more presentations and information in the lay press than the medical journals, just because of the lag time it does take for medical journals and studies to go through. But you can kind of see it's affecting teens, a year of anxiety and trips to the ER from the New York Times. Teens feeling disconnected, hopeless. Over in England from the BBC News, COVID, the devastating toll of the pandemic on children. On the Hill, the pandemic is causing a tsunami of eating disorders, and it's unlikely to let up. So we are seeing this, and they are seeing this. So let's step back. Why is it affecting the youth a little bit harder than it is the very young children and then also the adults? And you have to remember that children are still going to be growing up. They still have developmental tasks that they have to perform to become a full functioning adult. And these are the four tasks, and a lot of you are already aware of this, but I just wanted to bring this back. They obviously have to attain physical maturity. They go through puberty. They have to develop autonomy and separation from parents. In other words, they have to develop their own ideas, their own personality, and not just be the child of the parents. This is where peer pressure, peer groups, the same-sex attractions, opposite-sex attractions, their sexual identity, it starts to come into play here. They learn how to have a mature relationship. They go from concrete thinking to formal thinking. And finally, they have to find a productive place in society. In the United States, when they turn 18, they're expected to be graduated. And do they go into the military? Do they go to college? Do they start a business? Do they become a bum and move to Florida and become a beach bum? There's all those potentials, and they have to kind of decide this. But notice the asterisks. All the 3 out of the 4 require peer interaction, social experimentation, social acceptance, and it's very difficult to do this when you're cut off from your peers. When you're living at home, it's very difficult to do this. Not impossible, but more difficult. So this is an example from the National Syndromic Surveillance Program over the last year, looking at the number of emergency room visits for mental health visits from children 0 to 18, and kind of comparing the solid line 2019 and the dashed line 2020. And you notice that the first wave or the first several months, there is an increase in ER visits. And then it tends to kind of decrease. And this was also, we were seeing this decrease overall in ER visits, decrease in your office visits, decrease in urgent care visits. Then it slowly started to rise. And it's kind of been mirroring the 2019 kind of since then. So kind of remember that it rose first and then kind of decreased, because that'll be important later on. Don't have a slide for the next one, but when they looked at those ED visits, it did show a higher proportion of those ED visits were due to mental health. Not a great deal, but about 5 to 8% increase over the prior year. So let's look at the mood anxiety symptoms. So once again, we're just now starting to get some studies coming out on the COVID. It takes time. So long-term proactive studies we don't have. And we will certainly be getting those, but we're starting to get some kind of comparing pre and post data. So the depression, it does seem that the depressive symptoms worsened during the first wave. Then they tended to recover, and that tended to happen in the United States around summertime. Whether they're getting more used to it or whether also they were out of school, that may have a play of it. And that the symptoms tended to bump up with local lockdowns and increasing stricter public health measures. So locally, you do see ups and downs on this. The anxiety is a little bit more nuanced. Some studies show initial increase by decrease. Others showed decreases or no changes at all. And these are probably, we suspect that there is some increase. They were just not coming to the emergency room. They weren't coming to your offices. They weren't coming to public housing and aspects to help them. And it does seem to see specific populations were affected differently. And we'll go over this in a few slides. Looking at suicidality. There's, again, very limited evidence comparing pre and post, but some sources do show an initial decrease at the beginning. Other sources show that there was an increase in suicide attempts in the early months, and kind of one of the best studies, most likely through the whole year, is a recent study from Japan that showed an initial decrease followed then by an increase of completed suicides the second half of 2020. And these months are kind of related to more the COVID-related stressors, what's going on locally, what's going on even in the family, and that tends to be related to more increased chance for depression, anxiety, and suicidality. There was a big spike across the country. If you looked at the week before and then after prom, it tended to increase wherever that was. People were not able to go to prom. They had that really wanting that, kind of depicted by my quote earlier. Financial problems, if the parents lost a job, or all of a sudden one parent is having to make up and working two jobs. In-home conflict, changes in the living circumstances where they have to suddenly move. They have other family members that have to move in with them. That's all going to change this. And then you tend to get a spike in suicidality. Also, we saw eating disorders increase. And this include restrictions, binge eating, and compensatory behaviors. So there has been a drastic increase in outpatient assessments and hospitalizations at a local and the medical hospitalizations. We've also seen there is a large backlog for the regional and national eating disorder hospitalizations and referral patterns. Where used to be several weeks, now it's sometimes 4, 6, 8 weeks before they can get in. Also, if you had some minor pre-existing disordered eating, these increased symptoms tended to increase also this. And what kind of precipitated this? We think that a loss of social connections, that they're losing contact with their friends. If they were already in counseling, if they were getting nutritionists or going to your PCP, they had decreased access to this or telehealth. And telehealth is possible with eating disorders, and we're able to do that, but it's not nearly as well as coming in for an office visit. Also, just increased more anxiety and exposure to COVID-related media. In the United States, the Black Lives Matter movement is coming around. So this tended to bump all this up. So then you have to start thinking, well, what about the equity lens? So we do know that through smaller studies, nationally, internationally, it's listed that there are differences between different groups. The Black and Hispanic minority groups in the United States and over in Europe tended to have worse problems. If you have youth from lower income groups, they tended to have problems. And this makes sense. If you are not able to afford internet in your home, or you have one computer and you have to share it with 3 siblings and their husband, or the father who's trying to work, it's going to be difficult. How are they going to be getting schooling if they don't have internet or if they have to share the computer? The LGBT youth, if they've already come out and the parents have been accepting of this, then they tended to do well. But if you have the LGBTQ that haven't come out but normally would have, or if the parents and the relatives are not fully accepting, then they tended to have much greater difficulties. Youth with pre-existing mental health conditions obviously makes sense. If you've already got a promorbid condition for anxiety or depression, autism spectrum disorder, IQ difficulties, then you're going to kind of suffer a little bit more with this. The same thing with the neurodevelopmental conditions. So we do need to have more specific research in specific populations. And the two that seems to be not really come out yet is with the autism spectrum disorder and those with learning disabilities with or without attention deficit disorder. How has it affected this with the COVID and the virtual learning? Okay, let's go over to kind of the substance and media use. So there's been several screens that I encourage you to become familiar with if you already haven't. And the National Institute of Drug Abuse has come out with 2 of these. They're now available virtually. So you can use this virtually. You can give this, download and use this. It can be given to them ahead of time, or the provider can go over this. So the S2BI has been used for some time more than drug and alcohol, but it's a good one that should be used more widely. And the B-stat is also a good example to just screen for drugs and alcohol. Most of us are already familiar with the craft, but we're not familiar that the craft is constantly changing. It's gone through 3 versions at least before then the nicotine questionnaire was added. So this is the one that I'm now using and recommend, and kind of give these examples, what they're looking at: wine, marijuana, other illegal drugs, and then vaping, including nicotine or THC products. You can put the number of days, then you go to actually the craft. They should be answering question 5. Have they ever ridden in a car? If that's negative, then they can go on to the next page. If any of those are positive, then they should continue. But again, craft for car, do they use alcohol, drugs to relax? Are you using when alone? Are you forgetting things that you did, i.e. not sure what you did or blacked out? Do your family or friends think that you have trouble? You may think that you don't have trouble, but they do. Or have you actually gotten into trouble with outside of the family, school issues, the law? Now, media use is another area that's kind of changed. So before COVID, we were very cognizant of how much time our youth was spending on media. How much were they spending on video games? How much were they on their computers? How much were they on their phones? And we found out that then with switching to the virtual, that all of a sudden, all those rules just were thrown out of the window. You're using media now for education. You're using media to keep in touch with your relatives. You're FaceTiming or you're Zooming to other families and friends. So the timing has had to be being readjusted. But they did look at, a good study looked at India, Malaysia, Mexico, and UK, and they did find indications and changes using the internet, social media, gaming, depression, loneliness, and escapism, depending upon if they are able to use media, but if they're having problems, i.e. spending too much time or too little, they're having to share, or not having internet access at all. So the AAP has come up with some recommendations for screen time. This was pre-COVID, but it's cognizant of us to just be aware of this and kind of adjust this. But we should still allow an hour of physical activity and make sure they're getting adequate sleep. Now, the hour of physical activity can be tricky when they're confined to home, when they've got COVID or their parent had got COVID and they're confined. How do you do an hour of physical activity? There are ways, but it takes an ingenuity. We still recommend that they ban all electronic media approximately an hour before bedtime, and then tell them about the blue light can disrupt the sleep and the sleep initiation. When they do virtual learning, have them go out of their bedroom into a different room if at all possible. You'd be surprised how many youth will actually take on their computer and they'll try and be laying down in bed, learning school. You can imagine how much you're able to pay attention or drift off to go to sleep. So it helps to go to a different room. Have a designated media place and time, i.e. dinner time, for the whole family to come together and to be a family without the interactions. So this is a relatively new media screening tool that has become very common, the Prius 3. It's been validated for young, middle, and late teenagers. It can be self or provider administered, and it's available for online gambling, smartphone, or social media use. And then the questions you can see, and you can download this as we need to, but do they experience increased social anxiety? Do they feel withdrawal or uncomfortable when they're away from their smartphone or their video games? And have they lost motivation to do other things because they want to spend so much time on the internet or smartphone? So let's now kind of shift to more locally. What have we kind of seen locally in Chattanooga and specifically the Erlanger hospitals. That we have seen also an early rise in anxiety and depression during the initial months of the pandemic. And then it did tend to decrease during the summer and the fall. But also it tended to rise when local hotspot media, when all of a sudden Chattanooga became a hotspot. We saw a bump in anxiety, depression, and suicide. Also, when you go from the virtual, they get used to it. When you went from virtual back to school or back to the hybrid school, you tended to have a spike. And then if the school gets closed down because of contamination, they have to go back to virtual again, then you again see a spike. We definitely saw the rise of the severe eating disorders. You'll go over that later. I have been seeing more rise in the conversion reactions and somatization of the symptoms. That's not been verified by the data from Erlanger, but at least in the offices, I'm certainly seeing more of the pseudo seizures. I'm seeing panic attacks that they're thinking is due to asthma. I have a girl who's convinced that she's having panic attacks and breathing problems, and she has late undiagnosed cystic fibrosis. We've seen definitely a decrease in vaping and alcohol use, but then we've also been seeing more rise of marijuana and THC. And if you think that the teenagers are not getting edibles and other THC through inhalants, think again that they are, and with that is definitely rising. We definitely saw a decrease in STIs, probably because teenagers were not getting together. They're not getting together, they can't have sex. But now in the last several months, we're starting to see that rise again back to pre-COVID numbers. So this is kind of looking at the drug ingestions. The first aspect is all ED visits. Then the second is the Children's Hospital at Erlanger ED visits, and then the admissions. The blue is pre-COVID, the orange or red is the COVID. So actually you tended to see decreases in the ER visits and drug ingestions, but you did see an increase in admissions to the pediatric floor or to the PICU. Anxiety, same thing. We really didn't see much of a rise. It's basically the same as it was pre-COVID, but there was a bump in admissions to the hospital. Depression kind of goes along with what we were saying, that we actually saw less visits for depression locally to the emergency rooms, and that's all Erlanger emergency rooms, and then as well as the Children's Hospital. But we did see a slight increase in admissions. I was not able to get to the data for the mental health admissions directly, so I suspect that would probably be higher. Conversion reactions, this is what I was kind of talking about. We actually saw by the data from the ER visits and the hospitalizations decreases, but I bet myself and all of you are seeing more office conversion reactions. This is the eating disorders. This is just looking at only anorexia nervosa, since those tend to be more hospitalized. But we saw definite rises in all emergency room visits, Children's Hospital emergency room visits, and then definite increase in admissions. Also, the admissions are lasting or staying much longer because we are not able to stabilize them and then transfer them to a regional eating disorder hospital program, because they are also booked up. Everyone else, all the hospitals are booked up, so we're all funneling into this. This is also other eating disorders, from failure to thrive to AirFid to bulimia to binge eating. So notice pre-COVID, those aren't even popping up. And I don't know if this is a type of a coding error or not, but we didn't really see any Children's Hospital admissions. We had 4 pre-COVID, but then jumped up to 10. Suicide ideation, we're definitely seeing more visits in all ED visits, as well as the children's, and then admissions. This is again not counting the behavioral health admissions. So let's shift over. What does the impact of school closures doing? So this is from Canada, but I again want to kind of read this quote that gives you an idea of their mindset. I need the structure of a library, a classroom. In the classroom, I function perfectly and I perform well. But online, I'm just not able to, and I don't think I'm the only one who feels this way. I'm pretty sure there are other people who are going through the same situation as I am, who don't have either the environment or the surroundings or anything that encourages them. That discourages them from quitting their studies. So what are the challenges? When they're not in school, they have decreased motivation to do schoolwork. They have more difficulty with concentration for a specific class, let alone the whole class day. They're scared of not being prepared enough for the next school. And there's some studies coming out that showing even if you are paying attention, you're not learning as much virtually as you do in school for the majority of students. And then the anxiety of what's going to happen when school does reopen. Fortunately, there are some protective factors. Daily activity, getting peer support. So this is a study that kind of from the Journal of Adolescent Health that kind of showed that for attention deficit disorder, only 59% of them received the same services they were getting in school. So they had fewer routines, more remote learning difficulties. So this was not counting even learning disabilities just with ADD. So these population are struggling. This is actually very scary to me. Let's look at the long-term impacts of school closures. So going down to 2020, they're looking at prolonged life lost over a lifetime expectancy. So in the United States, they're expecting 13.8 million years of life lost. In Europe, 0.8 million years of life. So just with this year of the COVID, the shutdown, it's going to be affecting them ongoing. So what can you do? This is what I can kind of recommend is that emphasize to the seniors and the families that they need privacy, but they also need family time. Both are important. Need to continue the proper diet and sleep. Get that regular exercise, even if it's walking around the backyard quickly 5 times. Peer socialization, let them have some internet time to check in with their friends. Boys tend to do a lot of this on video gaming, the girls doing apps, but make sure they do have the capability of that. Have them reflect. They're going to be nervous. They're going to be scared. They can journal. They can do this through art or music. And then finally, counseling may be indicated that early evidence shows that telehealth counseling is just effective in most cases, and that brief interventional counseling is more effective than medication alone. Now, this data is from pre-COVID. We haven't done any during COVID or post-COVID, but it does, again, show counseling is the most effective. Medication is second, okay? And then using both of those is the most effective. So I want to kind of end on this take-home messages that there are short-term increases in mental health among all the youth, not just people that have gotten sick with this, but long-term studies is still lacking. They will be coming out, but long-term prospective studies just isn't there. There's several screening tools you can help screen for those that are really struggling. And that school closures and virtual learning does have major impacts on the youth during this year, on their families, but also lifelong. These are my references and citations. The journals were listed on the specific slides. And I want to give thanks to my friend and colleague, Dr. Chatty, who gave some of these slides and this information. So now I'm going to stop and be open to questions. Well, what a year it has been and what a year it's continuing to be. So the data that I've just shared has been current up to about 6 weeks ago. Some studies are still coming out, and there will be more studies coming out to go. And we know COVID is changing. We are at a different place the past month than we were, and we expect that it will continue to change and evolve. Fortunately, we means for the adults, and we encourage all the adults to get it. And as most of you know, Pfizer now has the vaccine that's available to teenagers from 12 and above. They're also doing studies from Moderna for teenagers that should be out probably within a few weeks to months. And then they're also doing studies to do those same vaccines as well as Johnson & Johnson down to age 5. And then they're also now just starting down to 6 months. So there will be continuing changes. Looking at some of these kind of questions, it's going to depend really on the patient, the support groups. One question says, does the emergency room and walk-in clinical providers receive special training on teen mental health? Not formally. I think in the formal training that's skirted and not given enough emphasis, that is increasing over time as we're starting to shift to realization that mental health issues are a problem, and we do not have enough counselors, we do not have enough social workers, we do not have enough child and adolescent psychiatrists. So it's becoming more important for us as the PCPs, for the walk-in clinics, ED, urgent, to be aware of this, to recognize this, to start treatment. Doesn't necessarily mean you have to continue treatment, but at least start it. Most of us can learn how to take care of a lot of these children very easily. Only the tip of the iceberg, then do we need to go on to somebody that's more specialized, especially if they have comorbidities. They can go to see more of specialized eating disorder patients or a child psychiatrist or someone in adolescent medicine if they do have multi-symptoms. But yes, we do need more training, and unfortunately, it's not formally, but we're getting more and more in Q&A sessions and learning centers. So encourage all of you to get that training. There's a question here. I've noticed more of my patients with ADD feel like they are doing better with virtual school than in person. I'm curious if this has been your experience as well. It again depends what type they have. If you think of they just have the pure attention deficit disorder, then when they're at home doing virtually, they often don't have the distractions of the teachers, of the kids whispering. And so they often feel that they do feel that they are getting better. However, most of them often then are more distracted at homes, they're less motivated. I've seen kids trying to do their homeworks, not getting out of bed. I've seen them trying to go do homework while watching TV or helping watch the little brother, and those that they do not do very well. If they have a comorbidity with depression, then depending upon what's going on in their family and the community, it can be an issue. But if the anxiety, definitely, it seems to help at home, but it kicks up when they go back to school. When they go back to hybrid, it does, very much so. The eating disorders, we're seeing not much increase, but the more severity is. We really didn't talk about child abuse, but we suspect that we have not seen as many reported during COVID. It is still going on. It's not being recognized by offices and medical offices and teachers, but it is going on, so we still expect that to be an issue. Last question, does Erlangen have any outpatient mental health providers for children and teen? Unfortunately, we don't. We are looking at different services. We do have the new mental health hospital that if somebody does need a short stay, they can go there. But pretty much you need to kind of go to your local resources. And as you know, it kind of depends upon who you're familiar with and insurance. Okay, so to wrap this up, just this is ongoing. It's going to be continuing to change, but it is affecting teenagers and youth. And they're calling this the lost generation. This generation from middle school to high school is definitely going to be affected. It will stay with them the rest of their life. And so we just need to be aware of this, that it's affecting them more than the younger kids, toddlers, or more than their adults. Thank you. If you have any kind of questions, please contact me or contact your local mental health provider. Thank you very much and have a good day.